Hi everyone, it's Jasmine, and today's video is all about binge eating disorder and the resources that are available to support those living with the disorder. So I hope you learned something in today's video, and let's get started. Now, what is binge eating disorder? Binge eating disorder, otherwise known as BED, is a recognized eating disorder that's characterized by recurrent episodes of eating large amounts of food, and these episodes involve a feeling of loss of control. Unlike bulimia, BED does not involve regular purging behaviors, and it's actually the most common eating disorder worldwide. What do we mean by a binge episode? A binge episode typically includes eating much faster than normal, eating until you're uncomfortably full, eating large amounts of food even when you're not physically hungry, eating alone due to embarrassment, and then feelings of guilt, shame, or distress after eating. BED affects people of all genders, ages, and body sizes, and it often begins in adolescence or early adulthood. It can occur in individuals who may appear healthy or normal weight to the general population. Many individuals suffer silently due to stigma surrounding speaking out about BED, and this disorder is frequently underdiagnosed for this reason. There are many common misconceptions about BED that we can take a look at together here. So, a myth is that BED comes from a lack of willpower, when in reality, it's a medical and psychological disorder. Some people may think that only people in larger bodies have binge eating disorder, when really it can affect people of all sizes. It's important to recognize that BED is not just about overeating, it involves a loss of control and distress. And there's a myth around BED that says that dieting can fix the disorder, when restriction often worsens the binge cycles and it requires a much more in-depth approach to treatment. Another myth exists which says that people can just stop binge eating, when in reality, recovery usually requires support and treatment at a professional level. There are many factors that can increase the risk for an individual to develop binge eating disorder, which can include emotional distress, so stress, anxiety, depression, dieting and food restrictions, trauma or adverse childhood experiences, genetic and biological factors, and social pressures and diet culture can really influence whether someone will speak out about binge eating or contribute to the stress that they may experience, increasing their risk for binge eating. There's significant psychological and emotional impact that can come from the disorder, including low self-esteem and body dissatisfaction, anxiety and depression, feelings of loss of control around food, shame and secrecy surrounding eating behaviors, and in turn reduce quality of life. Possible long-term health effects include weight fluctuations, digestive discomfort, metabolic conditions, for example, insulin resistance and increased likelihood of developing diabetes, sleep disturbances, and increased risk of other chronic illnesses over time. When it comes to diagnosing BED, it has to be done by a healthcare professional, and it's based on the DSM-5 criteria, as it is also indicated as a psychological disorder. Binge episodes must occur at least once a week for 3 months to be considered medically BED. Distress related to binge eating must be present for a diagnosis, and there should be an absence of And there should be an absence of behaviors that compensate for the binging, such as purging. If purging is involved, it is most likely considered bulimia, which is another eating disorder. Now, treatment and management for BED does exist, and effective treatments may include cognitive behavioral therapy, nutritional counseling, addressing emotional triggers to highlight the root of what is causing the binging episodes. In some cases, individuals may be prescribed medication. Involvement in support groups and ongoing therapy is crucial for better outcomes. And with all these supports, especially when combined, recovery is very possible. In Ontario alone, there are a number of eating disorder resources that can benefit those experiencing binge eating disorders and other eating disorders. One of these resources includes the National Eating Disorder Information Center, short formed as NEDIC, which provides information, education, referrals, and support for people affected by eating disorders. It offers a toll-free helpline by phone and a chat to talk with trained support workers about struggles and next steps, and has helpful online resources that can cover topics like identifying symptoms, treatment options, self-help guides, and support for families or friends. Another great resource within Canada and Ontario specifically is Body Brave, which is a free virtual support community that's based in Ontario for people affected by disordered eating. This resource offers online groups, self-guided support, and workshops with an inclusive and friendly approach, and there's no referral or diagnosis needed from a doctor. So while you may not feel as though you might fit each criteria that we covered in the previous slide about diagnosis, but you may notice yourself to participate in some of the practices and behaviors that are recognized as potentially binge eating, this is a great resource to reach out to get a little more support on understanding what's going on and how you can get help and support to treat it. Binge eating disorder is a serious and common eating disorder that's characterized by recurrent episodes of loss of control around eating and significant emotional distress. It affects individuals of all body sizes, ages, and backgrounds, and it's not a reflection of willpower or personal failure. Early recognition, reduced stigma, and compassionate support are essential for improving outcomes. And with appropriate treatment, including therapy, nutritional support, and community resources, recovery from binge eating disorder is possible and truly achievable. Thanks for watching.